Okay, good morning to all. Today we are going to study about the hemostasis. Okay, what is hemostasis? Hemostasis, that is the spontaneous arrest or prevention of the bleeding by physiological processes is known as hemostasis. Hem means blood stasis stops. The stopping of the loss of blood. That is hemostasis. It can be defined as the spontaneous arrest or prevention of bleeding by physiological processes. Okay, let us see how this mechanisms work out. The series of events that involved in the hemostasis, that is vasoconstriction, platelet plug formation, and coagulation. Vasoconstriction, platelet plug formation, and coagulation. What do you mean by vasoconstriction? Constriction, that term means narrowing. Vasoconstriction, that's the narrowing of the blood vessels. When an injury occurs, just before the injured site, there is the narrowing or the constriction of the vessel occurs. This prevents the reduces the loss of blood through that injured site. This is done by the local autocoid factors and the blood platelets and also the neurogenic reflexes, nervous and hormonal reflexes. This helps the constriction of the blood vessels. Thus, by constriction, actually the loss of blood through that injured site decreases. Okay. Then next we can see the next mechanism, that is the platelet plug formation. What do you mean by the platelet plug formation? Actually, here a plug is formed by the platelet. When an injury occurs, what happens here? Large number of platelets are released to the injured surface. To the site of injury, large number of platelets are injured. These platelets are adhered to the injured surface. And here they change their shape. Pseudopodia-like extensions form from the platelets because the platelets have the contractile protein. So it can causes the contraction and the change in the size, shape, and extensions, pseudopodia-like extensions forms. Platelets are activated. Activated platelet can, here you can see that platelet adhesion of the platelets to the injured surface, then the platelet release, and this platelet release to the, when this large number of platelets are released to the injured surface, they change their shape and the platelet becomes sticky. Thromboxane A2 and ADP is released from the platelets. Thromboxane A2 and ADP, that is released from the platelets, and this causes the stickiness of the platelets. This causes further release of the platelets to the injured surface. And this again, large number of platelets are released. They change their shape. They become sticky. Thromboxane and ADP is released. And finally, this platelets together form a plug and seals the injured surface. That's the formation of the platelet plug. And this can reduces the blood flow. This can prevent the loss of the blood through the injured site. And here, this is not a permanent hemostatic plug. It's a temporary hemostatic plug that is formed by the platelets. Like when we, it is similar to the closure of the some holes in the wall with something that we used in home. Like this, we can prevent the, like this, the platelet plug can prevent the loss of blood. Okay. Here, what is the significance of the platelet plug formation? Here you can see the platelets are released to the injured surface, release of the thromboxane and ADP, and they change their shape. Actually, platelets are very small cell having a diameter of about 2 to 5 micrometer. Here the size, their platelet become enlarged. And here it can see that injured surface. Here you can see the platelet plug. What is the significance of the platelet plug formation or importance of the platelet plug formation? It can close the minute ruptures in the very small blood vessels. There are large number of ruptures can be formed in blood vessels, small blood vessels every day. This is sealed by the platelet plug. And when there is the deficiency of the platelet, അല്ലെങ്കിൽ thrombocytopenia, there is the purpura occurs because of the bleeding through these holes. Multiple small holes through the endothelial cells that are often caused by the platelets by fusing with the endothelial cell. That is the significance of the platelet plug formation. Then this platelet, when it is released, it can causes the prostacyclin and the thromboxane A2. Thromboxane A2 that causes the aggregation of the platelet. Thromboxane A2 that can causes the aggregation of the platelet by the prostacyclin inhibit the platelet aggregation. Aspirin can be given to the patients, MI patients, normally small, low doses of aspirin is given to the MI patients. Here, aspirin inhibit the platelet aggregation and it acts as a blood thinner to prevent the block formation or prevent the MI. Then next we can see the blood coagulation here. Actually in the platelet plug formation, a temporary hemostatic plug is formed, but here a permanent plug is formed. Blood coagulation. How can we define the blood coagulation? Blood coagulation, what happens, the soluble fibrinogen is converted to insoluble fibrin monomer by the action of the activated thrombin. Normally the thrombin that exists in the inactive form prothrombin. This thrombin that is activated and this activated thrombin convert the soluble fibrinogen. Fibrinogen is a pentamer, high molecular weight plasma protein having a molecular weight of about 480,000 and this is converted to monomer, the fibrin monomer, pentamer, all the polypeptide chain, 4 polypeptide chains is removed from the fibrinogen and thus form a single monomer. Okay. Then next, okay, we can see the steps of the coagulation. Coagulation is actually for first year students it's a complicated process. It's a little difficult to follow and you have to take some more time to study this coagulation and it's a sure question for the exam. Okay, before studying the coagulation, first we have to know the clotting factors or coagulants. It is also known as procoagulants. Procoagulants or clotting factors. There are large number of coagulants or clotting factors and this is here we can mention some of them, that is about factor 1 fibrinogen, factor 2 prothrombin, factor 3 tissue thromboplastin, factor 4 calcium, factor 5 proaxillerin, factor 6, there is no factor 6, and factor 7 prothrombin, proconverting. Easily we can see the proconverting. Prothrombin conversion accelerator, it is also known as proconverting. Factor 8 is very important to remember, anti-hemophilic factor A. Anti-hemophilic factor A. This is when this factor 8 is deficient, it can lead to the hemophilia A, classical hemophilia. Factor 9, Christmas factor. Factor 10, Stewart factor. Factor 11, anti-hemophilic factor C. Factor 8 deficiency, factor 9 deficiency, and factor 11 deficiency can causes the hemophilia. Among this, most important one, that is the factor 8. Factor 12, Hegman factor. Factor 13, fibrin stabilizing factor. Beyond this, there are some other factors like the prekallikrein. It's also known as Fletcher factor, high molecular weight kininogen, and platelets. Okay, these are the important clotting factors. Factor 1 fibrinogen, factor 2 prothrombin, factor 3 tissue thromboplastin, factor 4 calcium, factor 5 proaxillerin, factor 7 proconvertin, factor 8 anti-hemophilic factor A, factor 9 Christmas factor, factor 10 Stewart factor, factor 11 anti-hemophilic factor C, factor 12, Hegman factor, factor 13, fibrin stabilizing factor, prekallikrein high molecular weight kininogen, and platelets. When we studied the functions of the platelet, we studied that platelet, that is the important function, that's the coagulation of the blood, clotting, helps in the clotting. Like this fibrinogen, when we studied the plasma protein fibrinogen, it's mentioned that fibrinogen helps in the blood coagulation. Okay, but these are the clotting factors or coagulants. Next, we can see the how this coagulation takes place. First, we can see the fundamental reactions that happens in the coagulation. That's a formation of prothrombin actuator complex. Actually, what is prothrombin actuator complex? Prothrombin actuator complex is the complex that converts the prothrombin to thrombin. The prothrombin that exists in the inactive form. If it exists in the active form, there is intravascular coagulation. Not only prothrombin, almost all the coagulants or clotting factors exist in the inactive form to prevent the intravascular coagulation. Once the prothrombin actuator complex is formed, it converts the prothrombin to thrombin. Prothrombin actuator complex converts the prothrombin to thrombin. Then the conversion of the fibrinogen to fibrin monomer by the action of the thrombin. Finally, the clot retraction. After the clot formation, clot retraction occurs. Okay, these are the fundamental reactions: formation of the prothrombin actuator complex, formation of thrombin, conversion of the soluble fibrinogen to fibrin monomer, finally the clot retraction. Okay, let us see the formation of prothrombin actuator complex. The prothrombin actuator complex can be formed by extrinsic and intrinsic pathway. Both extrinsic and intrinsic pathway that can causes the formation of prothrombin actuator complex. Okay, first we can see the formation of the prothrombin actuator complex by the extrinsic pathway. Extrinsic pathway that is activated when the blood is injury occurs, when the blood is exposed to the surrounding tissue, the collagen, the extrinsic pathway is activated. Here, at first, it causes the release of factor 3. Factor 3, that's the tissue thromboplastin, which is made up of phospholipid and lipoprotein. Here, first, when an injury occurs, it causes the release of tissue thromboplastin. Okay, this tissue thromboplastin, in turn, when it is released, it in turn activates the factor 7. That's the pro-convertin is activated by the action of the tissue thromboplastin. 7A, here it is written as 7A. Factor 7 is converted to factor 7A. This means the activation of the factor 7. Okay, then activation of this activated factor 7. Next, activated factor 7 act on the factor 10. Activated factor 7 act on factor 10. Now the factor 10 is activated in presence of calcium ions. In presence of calcium ions. Okay. So first the factor 3 is released. That is tissue thromboplastin. This factor 3 acts on the factor 7, and now the factor 7 is activated. Activated factor 7 acts on factor 10 in presence of calcium ion, and now the factor 10 is activated. Okay, actually the activated factor 10, it forms the prothrombin actuator complex. Here you can see the activated factor 10. Activated factor 10 in presence of calcium ion and factor 5. Activated factor 10 in presence of calcium ion and factor 5 that forms the prothrombin activator. Okay, but here first tissue thromboplastin is released. That is a tissue factor, that is the tissue thromboplastin, which act on the factor 7. Now the factor 7 is activated. Activated factor 7 act on factor 10. in presence of calcium ion forming the actuator factor 10. Okay. Then actuator factor 10 in presence of calcium ion and factor 5 that forms the prothrombin actuator. Okay. Here it is shown the prothrombin, how does prothrombin actuator converts the prothrombin to thrombin, that we can see later. Now the prothrombin actuator complex is formed by the extrinsic pathway. Next we can see the formation of the prothrombin actuator by the intrinsic pathway. Okay, here more steps are required for the formation of the prothrombin actuator. When this injury occurs, when the blood is exposed to the collagen and surrounding tissues, the intrinsic pathway that is actuated. Here, at first, factor 12 is released. Here it is written here, the blood trauma or contact with collagen, it causes the release of factor 12. Factor 12, that is the Hegman factor. Once the factor 12 is released, it is activated. As the factor 12 is released, it is activated. 12A, that means actuated factor 12. Okay, here the actuated factor 12 can act as a proteolytic enzyme. That means it can break the proteins. Actually, all these clotting factories are the made up of the polypeptide chain. Okay, here next actuated factor 12. Actuated factor 12, acton factor 11 in presence of high molecular kininogen and prekallikrein. Okay, actuated factor 12, acton factor 11 in presence of high molecular weight kininogen and prekallikrein forming the actuated factor 11. Okay, now the factor 11 is activated. Next, actuated factor 11, acton factor 9, not on factor 10. Actuated factor 11, acton factor 9 in presence of calcium ion forming the actuated factor 9. Okay. Third step is the actuation of factor 9 that takes place in presence of actuated factor 11 and the calcium ion. It acts on factor 9. Then now the actuated factor 9 is formed. Then actuated factor 9, acton factor 10. Here, actuated factor 9, acton factor 10 in presence of actuated factor 8. In presence of actuated factor 8 and calcium ions. Okay, actuated factor 9, acton factor 10 in presence of actuated factor 8 and calcium ion. Now the factor 10 is activated. Okay. Actuated factor 9, acton factor 10 in presence of factor calcium and actuated factor 8. Now the factor 10 is activated. Okay. Actuated factor 10 in presence of thrombin factor 5 and calcium form the prothrombin actuator. But here you can see both in extrinsic and intrinsic pathway, actually the activated factor 10, both in extrinsic and intrinsic pathway, activated factor 10 that forms the prothrombin activator complex. That form the prothrombin activator complex in presence of factor 5 and the calcium ions. Here you can see that activated factor 10 in presence of calcium ion and factor 5 form the prothrombin actuator. That's an intrinsic pathway. Here also in the extrinsic pathway, activated factor 10 in presence of calcium ion and factor 5 that forms the prothrombin actuator. Okay. Now the prothrombin actuator complex is formed. This prothrombin actuator complex, this is the prothrombin actuator complex, actuated factor 10 plus calcium plus factor 5, that is the prothrombin actuator complex. This prothrombin actuator complex acts the prothrombin, acts on prothrombin. Prothrombin is an unstable protein. It's an unstable protein having a molecular weight of about 68,000. It can be converted to thrombin by the prothrombin actuator complex. The prothrombin actuator complex acts on the prothrombin, and prothrombin is converted to thrombin. Okay, this thrombin is a soluble protein. This thrombin can act as a proteolytic enzyme. Thrombin can act as the proteolytic enzyme. The first fundamental reaction, that is the formation of the prothrombin actuator complex. Next one, that is the conversion of the prothrombin to thrombin. Then the third one, we can see that conversion of the fibrinogen to fibrin monomer. Okay, here again you can see the prothrombin is converted to thrombin by the prothrombin actuator in presence of calcium ion, and this thrombin act on the fibrinogen. Fibrinogen is a high molecular weight plasma protein. It's a soluble protein, soluble plasma protein that we already mentioned. And this fibrinogen is converted to fibrin monomer in presence of calcium ion. And here this fibrin monomer together form the fibrin network or meshwork, a network or meshwork. Here the thrombin actuated this fibrin stabilizing factor. The fibrin monomer that is converted to fibrin network form a close linked fibrin fibers by the fibrin stabilizing factor. The fibrin stabilizing factor actuates this process. Now the soluble fibrinogen is converted to insoluble fibrin monomer, which form a network or meshwork, and that is actuated by the fibrin stabilizing factor. This fibrin cross-linked fibrin fibers to this network, the cell adheres their RBC. That cells all adhere to form a plate, the clot. Now the clot is formed by this cross-linked fibers. Actually, this fibrin stabilizing factor that stabilizes the fibrin network. Okay, finally, there is the clot retraction. Here, the platelets, that large number of platelets are adhered to this network, fibrin network. So here, the platelets shrink with internalized fibrin within contracted platelets. Thrombin and accelerate fibrin, thrombin and calcium accelerate this reaction. The clot retraction takes place like a protein 2B and 3A receptors on platelets accelerate clot retraction, and the yellow colored serum oozes out. That happens within 5 to 30 minutes. Actually, the functions of the clot retraction, it retracted clot seals the injured blood vessels and facilitates the wound healing, prevent the thrombolysis. Clot retraction that seals the injured blood vessels, facilitates wound healing, and prevents the thrombolysis. Clot retraction that can be invaded in disease condition like the platelet deficiency, Landsman's thrombocytopenia due to deficiency of 2B and 3 receptors on the platelet surface. Now that's about the coagulation. Coagulation, what happens in the coagulation? Here the soluble fibrinogen is converted to insoluble fibrin monomer by the action of the thrombin, and finally a clot is formed, permanent clot is formed on the injured surface and completely prevent the loss of the blood. Normally, our everyday life that happens in the injury, like normally during the day-to-day activities with knife or blade or sharpness, that can happen, and after some time if the minute injury is minute, the blood loss is prevented immediately, and this happens when we take the blood for the laboratory purposes also. Here you can see the stoppage of the blood after some time. Okay, but here the once more hemostasis, that is the conversion, prevent the loss of blood when an injury occurs. Hemostasis can be defined as the spontaneous arrest or prevention of the blood loss, and this occurs by the vasoconstriction, platelet formation, and coagulation. Vasoconstriction, that is the constriction of the blood vessels at the injured site to prevent or reduce the loss of the blood through that injury. And platelet formation, when an injury occurs, if the injury is minute, here to the injured site, large number of platelets are released, and the platelet change their shape, they become sticky. Finally, the platelet form a plug to the injured surface, which is a temporary hemostatic plug. And the coagulation is the formation of a permanent hemostatic plug by the conversion of the soluble fibrinogen to insoluble fibrin monomer by the action of the actuator thrombin. Thus, coagulation steps, there are fundamental reactions, the four fundamental reactions, the formation of the prothrombin actuator complex by extrinsic and intrinsic pathway, then the formation of the thrombin, then the conversion of the fibrinogen to fibrin monomer, finally the clot retraction. Okay, here you have to study the steps for the coagulation, both by extrinsic and intrinsic pathway. And normally, the students will stop the writing after the formation of the prothrombin actuator complex because they too much steps are involved in this process. But most of them will forget to write the conversion of the prothrombin to thrombin and the formation of the fibrinogen to fibrin thread. Please don't forget to write that steps. When after the formation of the fibrin threads and fibrin network, the clot formation takes place. Okay. Then along with this, when the sometimes the question will be like this: define hemostasis. Describe the mechanism of coagulation and write a note on and add a note on hemorrhagic disorders or anticoagulants. Let us see the hemorrhagic disorders. Main points of the hemorrhagic disorders. Hemorrhagic disorders, that means the bleeding disorders. When an injury occurs, the bleeding, uncontrolled bleeding occurs. That's known as the hemorrhagic disorders. Hemorrhagic disorders can occur either due to defective blood clotting. That's due to the deficiency of the clotting factors, deficiency of the vitamin K, and the anticoagulant overdose, and the defective capillary contractility like the purpura, or by combined defective blood clotting, or by the defective capillary contractility. Let us see the hemophilia. Hemophilia is the common one, and this hemophilia that occurs, hemophilia, this uncontrolled bleeding occurs when there is an injury. This is the causes due to the deficiency of the factor 8, factor 9, and factor 11. Factor 8 deficiency, that is, causes the classical hemophilia. And this is known as royal disease because first it's identified in the Royal British family, so known as the royal disease. And here the characteristic features of the hemophilia, that's the bleeding tendency, soft tissue hematoma, hemarthrosis, and crippling arthropathy occurs. The hemophilia can be diagnosed when we do the bleeding time and the clotting time. The bleeding time will be normal, while the clotting time will be prolonged. Normally, when we collect the blood in a test tube and kept it for some time, after half an hour, the clot is formed and the serum comes above the clot. But in the hemophilic patients, this does not happen. If a clot is formed, it's a soft clot. Clot will be soft. And normally the treatment, that's either the fresh blood transfusion or injection of the factor 8 or thrombin or thromboplastin can be given. Then the hemophilia B, that's the factor 9 deficiency or Christmas factor deficiency. The clinical features are same, the bleeding tissue tendency, soft tissue hematoma, like that. But this is not so common as the hemophilia A. Treatment, that is the injection of the factor 9 or the fresh blood transfusion. Then vitamin K deficiency. Actually, vitamin K is essential for the formation of the factor 2, factor 7, factor 9, and factor 10. When there is vitamin K deficiency occurs, the factor formation will not take place. So the bleeding disease can be seen. Normally, the treatment, that is the injection of vitamin K. Purpura, that is a either occur due to the deficiency of the platelet or due to the capillary defects. Here the purpura can be defined, diagnosed by the normal clotting time, but when we do the bleeding time is in place. And then what is the significance? Normally for the first year hematology practicals, we are doing the bleeding time and the clotting time. What is the significance of doing the bleeding time and the clotting time for the dental students? Actually, what is the significance? Here, for the patients those are coming for the teeth extraction, they have the bleeding disorders like hemophilia or thrombocytopenia. We have to take care of the patients to avoid the excess bleeding. It's very, very important, especially in the surgery department. Thrombocytopenic purpura, that's the mild, moderate, and fulminating. That's if the normal platelet count is about 1.5 to 4 lakh. When the platelet count decreases below 50,000, it can lead to the mild thrombocytopenia. And how can you identify a thrombocytopenic patients? You can see the dark purplish blotches on the under the surface of the skin. The thrombocytopenic patients can be identified by observing the dark purplish blotches under the surface of the skin. Okay. Then a thrombocytopenic purpura, here the normal blood count, normal platelet count is normal. Then the thrombocytopenic purpura, here the normal platelet count, but the circulating platelets are abnormal, so it cannot do its normal function. Okay. About the hemorrhagic disorders, mainly the hemophilia and the thrombocytopenia. Okay. Now we discussed about the hemostasis, the mechanism of hemostasis, and the major part, that's the coagulation, the fundamental reactions of the coagulations, and how the clotting factors of the coagulation takes place, and the bleeding disorders or the hemorrhagic disorders. Okay. Another question that can be asked under the hemostasis, that's the anticoagulants. Anticoagulants are the substance that prevent the coagulation, that we can study in the next class. Okay, thank you.